Most people think they know what it feels like to have a heart attack. Like the movies, they imagine it's going to be a very sharp pain, sudden, dramatic. But that's not always what it feels like. Instead, many people who've had a heart attack often describe it as pressure. In fact, that's what the textbook says as well. Tightness, heavy sensations sitting right on top of the chest. Some people feel discomfort in the neck, in the arm, the back. Others feel short of breath or nausea. But sometimes symptoms are so subtle that people second guess themselves, especially women who are more likely to present without chest pain compared to men. Just like blood pressure, where many people assume that if they feel fine, then things must be normal. But the body doesn't always send a very loud warning. Over the past few weeks in this series, we've talked about high blood pressure, diabetes, and cholesterol. These are all conditions that quietly change things inside our arteries over time, leading to cardiovascular disease. Today, I'm bringing it all together for you. I'm talking about heart disease, specifically heart attacks and strokes and how they happen. What symptoms do you look out for? How do you decrease your risk overall? Because when you understand the process, prevention feels like it is within reach, and I want to let you know that it is. Welcome to Fuller Living, your space for empowerment, inspiration, and practical health nuggets. Here you'll find relatable guidance that fits your everyday life as you journey to a fuller and healthier you. I'm your host, Dr. Ashitey. Let's dig in. Welcome back to another episode of Fuller Living. Wherever you are, whether you're driving, getting ready for your day, going for a run, or just chilling, as always, I'm so glad you're here. Over the past few weeks, we've been talking about Cardiometabolic Health 101, talking about some of the conditions that quietly shape our long-term health, like high blood pressure, diabetes, high cholesterol. Today, I'm bringing it all together as we talk about heart disease. More specifically, heart attacks, how they happen, how can we reduce our risk, and how can we prevent strokes or heart attack over time. But let me start with a story. Let's call my patient Miss A. Miss A was 65 years old and had many of the conditions that we had talked about. She had a history of high blood pressure, she had high cholesterol, diabetes, and she'd previously had a coronary artery disease or plaque buildup in the arteries of her heart. One day, she developed sudden onset sweating. She described a heat sensation on her head and neck. And shortly after that, she started feeling tightness in her neck. And those symptoms would come and go. Something was definitely wrong. Here's the problem. She was scheduled for a procedure in the hospital that day, one that she'd waited for months and months before she could get it. What was she going to do? Well, she did the right thing and called EMS, the emergency medical system over here. When they arrived, they did an EKG, it looked normal, and based on that, they reassured her. In fact, they told her she should stay home. They told her that if she went to the hospital, it was going to be a waste of her time. There wasn't going to be anything they could do. They're not going to find a heart attack because your EKG was normal. Stay home. They were wrong, but we're going to get into that later. Symptoms like that should never be ignored. They must be evaluated in the hospital because heart attacks don't always announce themselves the way that we expect. And that's why this conversation matters. You must know when to act. You must know when to act promptly. Today, I'm going to talk about heart disease, how heart attacks and strokes happen in your body, how the conditions we've discussed over the past couple of weeks, like high blood pressure, diabetes, cholesterol, all quietly contribute to it over time. And when you start to understand the process, you are in a much better position. You are better equipped to recognize the warning signs and to take the steps that you need to take to lower your risk. Understanding heart disease and how it develops, how to recognize when something is wrong, and most importantly, how to reduce your risk of getting a heart attack or stroke, or the risk of your family members, because you're going to share this information for them. This can be life-changing for you. And I am so excited about it, so let's get into the details. To understand heart disease, we have to go all the way back to the arteries themselves. Think about your arteries like pipes. They carry blood throughout the body. In a healthy artery, the inside of that pipe should be smooth, flexible, and open. Blood flows easily, delivering oxygen, nutrients, and all the good stuff to the heart, the brain, and all your organs. But over time, that pipe can begin to change. And the three conditions we've been discussing in this series, high blood pressure, diabetes, high cholesterol, each can affect the pipe in a different way. High blood pressure creates strain on the artery wall. Imagine water flowing through a pipe under high pressure. Then it was designed to actually handle. Over time, that pressure is going to create tiny areas of stress and damage along the lining of the vessel. Diabetes and high blood sugars contribute to inflammation and make the lining of the artery more vulnerable. Then comes in cholesterol. Cholesterol particles circulating in the blood can begin to settle in those damaged areas along the artery wall, and the body recognizes this as something that's abnormal and sends immune cells to respond. Over time, that area becomes thicker, and what started as a smooth inner lining starts to build up plaque over time. This process, as we've discussed before, happens slowly, oftentimes over decades. The artery gradually becomes narrower and less flexible. Blood still flows, but the space inside that pipe is smaller than it used to be. And there's the moment that causes the emergency. Sometimes that plaque becomes unstable and ruptures. When that happens, the body forms a clot in an attempt to repair that injury. But that clot can suddenly block the pipe, the artery. Now, if a blocked artery is supplying the heart, the tissue there can die, and that's a heart attack. If that blocked artery is supplying the brain, that tissue can die or start to die, and that's called a stroke. And this is how everything that we've talked about in this series comes together. High blood pressure damages the lining of the arteries. Diabetes increases inflammation in those same arteries. Cholesterol contributes to buildup in the lining of those arteries. And understanding that process is very key to prevention. Because when we control blood pressure, when we manage our blood sugars, and when we reduce that circulating cholesterol, we are literally protecting our arteries and reducing our chances of that plaque buildup over time. That's how we reduce our risk of a heart attack and stroke. Now, here's the important thing. The symptoms of a heart attack don't always look the way that people expect. Many people are waiting for that sharp chest pain, but heart attacks often feel different. People commonly describe pressure, heaviness, tightness in the chest, not necessarily sharp. And that discomfort can sometimes spread to the neck, the jaw, shoulders, or arms, sometimes without the chest tightness altogether. Let's return to my patient's story. She had several of the risk factors we've been talking about, high blood pressure, diabetes, and high cholesterol, just to remind you. And she had a known history of heart disease, meaning she'd had a heart attack before. When the sweating started, that intense heat that came across her head and neck, followed by the tightness in her neck, she knew something was familiar. And so she called EMS. Very appropriate. They performed an EKG, which looked normal. And based on that, she was told to stay home. But her symptoms didn't go away. And she knew something was wrong based on her past experience. So she decided, well, since they're saying this, let me just go for my procedure as scheduled. When she arrived, she told the staff, and their response, you're probably okay. The procedure's already scheduled. They advised her to proceed. She remained uncomfortable, though. So when the anesthesiologist showed up, she told her story again, third time. The sweating, the heat up her head and her neck, the tightness that kept coming and going. And the anesthesiologist immediately stopped everything and transferred her to the ER because the procedure could wait, but her life could not. Again in the ER, her EKG came back normal. But this time, her blood work was done, and she was indeed having a heart attack. She was urgently wheeled back into the cardiac cath lab where the blocked artery was opened. And today, my patient is alive to tell the story. She is alive because she trusted her body and what it was telling her and advocated for herself. Heart attacks don't always present the way that people expect. Sometimes the earlier tests may not immediately show what's happening. And this is why knowing your symptoms, listening to your body, and taking prompt action really matters. Now that we understand how heart attacks happen, the next question becomes, how do we reduce our chances of this process reaching this point? The answer comes back to the same things we've been talking about throughout these series. Number 1, blood pressure control. Remember that earlier we talked about high blood pressure creates strain along the arteries wall, and over time that pressure is going to create tiny areas of stress or injury along the vessel. Those areas become places where cholesterol particles are more likely to settle and start forming plaque. When blood pressure is well controlled, we reduce that constant strain in the artery wall, and the lining stays healthier, and the conditions that allow that plaque to form become less likely. This is why controlling high blood pressure really matters and is one of the most powerful ways you can help prevent a heart attack or even a stroke. Number 2, blood sugar control. Diabetes or prediabetes. When blood sugar stays high over time, it starts contributing to inflammation and damage along the linings of your arteries. That inflammation makes the blood vessel more vulnerable to plaque formation. Managing your blood sugars reduces that inflammatory stress on the arteries and slows that progression of plaque buildup. This is again why diabetes management plays such a huge role in heart disease prevention. Number 3, manage cholesterol. In the previous episode, we talked about how cholesterol particles circulate through the bloodstream, and when there's too much of it moving through the arteries, there's a higher chance of it settling into those vulnerable areas that high blood pressure and other things can create. Lowering your cholesterol reduces the number of particles traveling through the arteries. Less traffic in the pipe means fewer opportunities for buildup. Over time, you're significantly lowering your risk of forming plaque or it rupturing. But last but not least, lifestyle habits really matter because lifestyle influences all these systems at the same time. Movement improves how your body processes your fats and sugars. Nutrition patterns are going to influence your cholesterol levels and the inflammation in your body. Healthy sleep is going to improve your blood pressure and your metabolic health. Avoid smoking. I need to talk about this. It is the worst thing you can do for your arteries. It is the worst thing you can do for your health. But over years and decades, they change the environment inside your arteries in ways that dramatically reduce heart attack and stroke. Lifestyle really matters. Let me touch on one more thing before I forget. For some people, lifestyle changes are not enough. They may have a family history, stronger risk factors. And so for these people, medication may become part of their long-term strategy to reduce risk. It is not a failure. This is simply just another tool to protect your arteries and lower your chances of having a heart attack and stroke. Let's tie it all together. Heart disease is the leading cause of death around the world, but it is also one of the most preventable. And when you understand the process, that becomes much clearer. Heart disease doesn't suddenly appear overnight. It develops quietly over years. It's happening right now inside our arteries. High blood pressure creates strain along the vessel walls. Elevated blood sugars contribute to inflammation and damage. Excess cholesterol particles circulate throughout the bloodstream and can start settling through those vulnerable areas. Over time, plaque forms, and sometimes that plaque can rupture, creating a clot that blocks an artery feeding the heart, leading to a heart attack, artery feeding the brain, leading to a stroke. That's the process we've been walking through together this entire series. High blood pressure, diabetes, cholesterol, and today, heart disease itself. Each of these conditions affect the same system, the arteries that carry blood throughout the body. When we manage those risk factors well, we are protecting those arteries and reducing our chances of this plaque building up and causing problems down the line. Remember, prevention is not about perfection. It's about your trajectory. The choices we make over years and decades influence those arteries and what they're going to look like later in life. And this is where the opportunity is. So much of this process is modifiable. You can manage your blood pressure. You can reduce your blood sugars. You can reduce your cholesterol levels. You can build the habits that support your long-term cardiovascular health. Each of these steps help protect the arteries and reduce our long-term risk. So, now that you know, here is your SMART goal for the week. Remember, a SMART goal is one that is specific, measurable, attainable, relevant, and time-bound. Specific, schedule your physical. Measurable, your appointment can be confirmed and it's done. Achievable, it just takes one phone call, one booking. Relevant, knowing your blood pressure, knowing your cholesterol, your blood sugars, identifying your risk early is part of your long-term strategy for a healthier and fuller life. And time-bound, let's do this over the next 7 days. If this series has helped you better understand how the body works, please share this episode with someone you care about, a parent, a sibling, a friend. And make sure you're following this podcast because you don't want to miss future episodes. And if you've been enjoying the show, take a moment to give me your 5-star review. It helps more people find this information. I can't wait to see you next week. But until then, let's get to fuller living. Well, fam, that wraps up another episode of Fuller Living, where we talk about health in a bite-sized, relatable, practical, and fun way. Remember, it's not about being perfect. It's about making progress one small step at a time while remaining consistent. If you found this episode helpful, please subscribe, share it with a friend who might need a little bit of inspiration, and leave me your 5-star review. And if you're in Dallas and looking for a new PCP, look me up at southwestfamilymed.com. I can't wait to meet you. Until next time, let's get to fuller living.